and everywhere else in the world, comprehensive discussion on COVID-19 and, of course, other health situations. But today, it's the COVID situation. And we've been doing this since the 2nd of February, Dr. Sessionimudi, I'm sure. So very soon we'll be doing that for 2 years, won't we?
Exactly.
And I'd like to say congratulations to you for, and well done, and thank you very much for being such, I don't know how to describe you anymore. Take off time, work, and you're a very busy woman that you are, a medical, a doctor and a psychiatrist, but you make sure that you're here on the program, starting from, first of all, from the HRB breakfast, and now on coffee break. You're always here.
Yes.
And thank you so much. By the way, I'd like to remind you that we're live on Facebook, so check us out on Facebook. Go to my page, or go to Dr. Session's page, and you'll find us. Good morning, Dr. Session, and welcome to the show. Sorry, I'm talking too much this morning.
No, you go ahead. Good morning. It's good to see you on top form as always, and thank you so much.
Yeah, welcome to the show. You're looking bright and beautiful as ever.
Thank you.
And we're about to talk some serious COVID talk.
Yes, so things are looking quite optimistic, I would say. There's lots going on, but it's looking a lot better. Obviously, the government has now announced from the 27th of January, the Plan A will come into effect. So they were removing Plan B. So that means that masks are no longer compulsory, and certain indoor places and organizations will review their policies about whether people should wear masks or not. It was also looking at the NHS passes and COVID passes, whether that was going to be something that organizations will then decide on their own, whether this is what is needed.
Absolutely.
So,
Absolutely.
and also working from home was no longer deemed.
Yeah, let's just talk about some of the restrictions that will be lifted. There's something happening today, the 24th, isn't there? There's some kind of lifting. Is it? We're not supposed to, not supposed, but we don't have to wear masks anymore. Does it start from today or from the 27th?
I think when I've looked on the government website, it said from the 27th, everything of Plan A will come into effect. But my understanding was that from Monday, which is today, masks would no longer be compulsory. And I think in terms of Department of Education as well. So they're still reviewing all the different situations and places where masks will be compulsory or not.
Right. Okay. You remember we talked about, many times we talked on this show and on HRB Breakfast, we talked about that the fact that the government wants to make it compulsory for health workers to be vaccinated.
Yes.
Otherwise, they'll lose their jobs somehow. Yeah. And then we got the news that from the 3rd of February, every NHS worker or every health worker in this country will have to have at least their first jab.
Yes.
And if not, then they're going to have to lose their job.
Yes, I think that's still a concern at the
flying
moment.
Around left, right, centre to nurses and doctors and health workers, warning them that from the 3rd of February, something's going to happen. But vaccination be delayed to prevent staff shortages in England. What's your take on that?
Yes, this is quite concerning because I think what's happening is there's a group of people that are willing to take the vaccines, and obviously there are a group of people that are not willing to take the vaccines. However, working on the front line and being an NHS worker, most people have been told that the government guidance is that you do need to take the vaccines, and they've given deadlines of, I think, the 2nd or 3rd of February and then the 2nd of April if they don't have both vaccines. So it is, as much as I would like to say it's pro-choice, I think it is unfortunate if people are not taking the vaccines and if they are working on the front line. My opinion is that as NHS workers and as healthcare workers, whether we work in the private sector or NHS, it is our responsibility to ensure that we are keeping ourselves safe, keeping our loved ones safe, and the community at large. And if we are putting ourselves in a position where we are more vulnerable to get COVID-19, as you know, in hospitals, we do have to treat patients with COVID-19. And if you are not vaccinated, you are actually creating a higher chance of you getting it, a higher risk, and then passing it on to other patients and your loved ones and the community at large. So to be honest, I think we all have a responsibility, and these group of people do need to take the vaccine.
Well, to be fair to the health workers and NHS workers, majority of them have already had the vaccine. It's just a few of them who, and of course it's their right, do not believe that the vaccine will help them, and so therefore they don't want to take it. But then again, what the Royal College of GPs are advocating is not that it be scrapped completely, but they're asking that the deadline for these health workers be moved further afield or further on. So in a way, I do understand. I do understand where the GPs are coming from. They're not saying, okay, no. But they're saying, okay, 2nd of February is a bit too close. Otherwise, there's going to be a huge shortage in staffing in the NHS. And that brings me to my second point. Mark Drakeford, the First Minister of Wales. Let me pull this story up and I'll tell you what he said. Okay, it's funny, but he's saying, and I did this news yesterday in one of my shows. I can't remember which one, whether the first one or the second one, but it doesn't matter really, does it? What he's saying, hang on a second, I'm looking for it.
No, that's fine. But just in response to the dates, in response to the dates, I do feel that I feel the dates could be postponed. So we could change the dates. I think people working on the front line need to know that they need to take the vaccines, but the dates could be changed. I don't think it should be that, that deadline is given. It's so tight because obviously we know as well between the first and second dose of the vaccine, there needs to be a time period of waiting for the next vaccine. So I think giving them that deadline is putting a lot of pressure. Yeah. And again, a lot of pressure on our NHS, those and short stoppages, which shortages of staff, because it's obviously going to impact on staff.
Already it is impacting. Already some hospitals are like properly stretched and they haven't got the staff. And therefore it's affecting everybody. It's a cycle really. If nurses and doctors cannot go into work because they are not well, then it definitely will affect patients. And then when it comes to the crunch, where some of them don't want to take the vaccine because of one reason or the other, which of course they're entitled to their own reasons and their own rights. And then what we know is they're going to have more short staffing, and it will trickle down to us, the patients, that. Anyway, so I have found the article, and sorry about that, Dr. Session. I keep talking. I'm talking more than you are. I'm supposed to be asking a question and you're supposed to be answering it, but I'm talking. It's just that, sometimes I get overwhelmed with all this information and all these questions. Anyway, First Minister Mark Drakeford of Wales would not rule out, listen, recruiting NHS workers from England who leave their jobs due to its mandatory vaccination policy. So they are ready. Wales is ready. When he was asked, that is it, are you just going to take him on? He said, yeah, of course. It depends on how they fare in their interviews. So in fact, he's trying to say that if if these people, unvaccinated NHS staff from England, want a job in Wales, they will get it.
Well, that's fantastic. To be honest, I have spoken to other colleagues, and some colleagues are leaving different private and NHS jobs. And there are other places that are willing, locally, even in the UK, that are willing to employ people in the healthcare sector without the vaccinations. So I think it's such a difficult position to be in. I don't envy the people that have to make this decision. As I said, it is pro-choice, but at the same time, we have a responsibility. And working on the front line myself, Opoku, and hearing from other colleagues, daily people are testing positive. So definitely working on the front line does put you at a higher risk. And if you have the vaccines and if you've taken the vaccine, has helped reduced if you did get the COVID-19 infection, it helped reduce the morbidity and mortality, as we've seen globally and specifically in the UK. It's helped our patients. So I'm definitely an advocate for people taking, and especially those on the front line, the heroes, they're working on the front line is definitely, these are our heroes, NHS heroes, private healthcare heroes, working on the front line and putting yourselves at risk every day going into work. Kudos to them. They're doing a brilliant job, helping to keep the NHS providing safe and effective care, and the same in private sectors. So for me, it is a shame that people are deciding not to take the vaccine when they know for a fact that there's a high risk of them contracting COVID-19 and then passing it on to others. So I think a lot of people that are in this position need to probably speak to other healthcare workers, speak to advisors, get some more support and counseling. Maybe the NHS needs to look at putting in some sort of support services for these people, and especially during these times, if they're going to lose their jobs because they've not taken the vaccine, people depend on their salary, it's their livelihood. So I really hope that they make the right decision and do take the vaccine, and maybe the government will consider postponing the date. But to be honest, I think it's highly unlikely. I think that's the position we are going to be in, where you either have to have the vaccines, and if you don't have it, you will be obviously not able to work.
Dr. Hashmi, you know me, pro-vaccine, and I've always spoken for the vaccine. I've got all my jabs.
Yeah.
And I always tell my friends and relatives, go and get it, because it will help. And at the same time, who loses if these people decide we don't want it? Because, for one reason or the other, some people might not want it for religious reasons. They might not want it for health reasons. They might not want it because it's just their right and they don't feel like they want to get it.
Yes.
And if these people are sacked from the NHS, who suffers? That is the question that I keep asking. Who suffers? At the end of the day, they don't suffer. It's us who suffer. Of course, they can always take a train and go to Wales and get a job.
Yes.
rent is cheaper in Wales, actually.
Yes, and people are so friendly in Wales. So, Wales is absolutely beautiful. And the sceneries are breathtaking.
Yeah, so that's a question I keep asking myself now. I ask people. The government's got to do something about it. And I do agree with the Royal College of GPs in the sense that they're not necessarily asking that it be scrapped completely. They're just saying give them some time.
Yeah.
Give them some time. I don't know. It's just I wish everybody was jabbed, but at the same time, you cannot force everybody to be jabbed. At the same time, people know what they want and what they don't want, and you can't tell them not to want it or not.
I do understand, but I still stand with my view and opinion that people need to get vaccinated. If you're working on the front line, you have a duty of care as a healthcare worker to protect other people. You know, we take oaths when we become doctors, nurses. You know why you're doing it. You're doing service to other people, and the intention is to help and care for other people and to heal. And we're not supposed to cause any harm. And if there's a way of reducing risk of contracting COVID-19 whilst you're working on the front line and taking care of patients, and that is by taking the vaccinations, then I do believe every healthcare worker has that responsibility to take the vaccine. Yes, it is about pro-choice, and I'm all for pro-choice, but we need to draw a line where we need to think about our loved ones, our communities who suffers because these people are not willing to take the vaccines. We've taken the vaccines and we've been fine, and thousands and millions of people in the UK have been vaccinated, as you've said, Opoku. So it's not like we're asking them to take something which is going to be hugely damaging to them. We obviously only know that there's some side effects which are minimal and very, usually last only like within a few hours or 48 hours, between 24 and 48 hours. Usually people recover from these side effects. Some people might have more side effects, but they're not side effects that you cannot manage or cope with. And obviously, other effects, if people are concerned about, then they need to talk to their health practitioners or nurses. But to be honest, I do believe that they need to take the vaccines, and it will not only protect them, it will protect others, other people, their loved ones, and it will reduce the risk of COVID-19.
I believe the same too, Dr. Session. I really do. Except that there's nothing much I can do, you and I can do about the fact that some people do not want to take it, and some people do not believe what we believe.
Yes. Well, now we have even now a new variant. We have a new variant.
Unfortunately. Sorry, say again, please.
No, sorry, Opoku, for talking over you. But there's a new subvariant of the Omicron, the variant. So the BA2, which is a new variant. According to scientists and researchers, this has been around since the 6th of December. We started to see the Omicron wave after the Delta wave in November, around the 23rd of November. Now, according to scientists, they've discovered another mutation or variant of the Omicron, which is the BA2, and which they've found about 426 cases in the UK, most of them in London and in the southeast. But they have found this as well in other countries. So India, Philippines, Denmark, Germany are other countries where they are seeing the variant of the Omicron, the BA2. And I think the concern is obviously we saw the Omicron overtake from the Delta variant. So they're wondering, they're still doing more research into it. So we don't know much about this variant. But there's about 6,112 cases worldwide where they are looking at these cases.
Yeah.
Worldwide.
You know what, Dr. Seshnik, ever since we started this update on the coronavirus situation, we've talked about different variants. In fact, from the beginning, you did.
Yes, you did.
Made us know, at least let me know that there's going to be mutation, whether we like it or not. The virus is going to be mutating because it's intelligent. Yeah. You used the word intelligent. And so it will mutate. But fortunately, or I say thankfully, it's not been that dreadful, except probably for the Delta variant, which is a bit kicking. But then Omicron and all that, it's probably more transmissible than the other variants. Well, so far as I know, I don't know about this new one, but the Omicron was and still is very transmissible, but the effect on hospitalization and deaths and all that is much, 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 much lower than the other variant. You know what? The reason I don't even know about what you're talking, this new variant, is probably due to the fact that nobody gives a damn anymore. Oh yeah, new variant, yeah, okay, hello, okay, bye-bye, that kind of thing. Because Omicron, it was all in the news and everything. 2-3 days later, it was, yeah, okay, another, yeah. Let's get on with life. you know. And I must confess that I do like that attitude. That we're not going to fear it, but we're going to face it.
Let's not fear it and let's face it. And you know, it's so coincidental that you're
That's
saying
your
this.
saying. You always say that. Fear not. Don't fear it. Face
I know. Let's not fear it. Let's face it. I love it. And thank you for that reminder because, and for what you just said now, I actually called someone this weekend and we were talking and I said, oh, we're being really safe because of, the Omicron variant and, you know how cautious, super cautious I am with Ferdy and the kids. And, and he said to me, yeah, no, I'm just trying not to think about it. And, life is just going on, like normal. And this is exactly the attitude, exactly what you said. People, it is there, it is in the news. People are getting to know about the updates, about the mutations and the changes in treatment, and what's happening globally in terms of the COVID-19 and vaccinations. But it's something that we are living with, and people are adjusting to the fact that this is part of life. We are going to hear about these different variants and the different strains, but that doesn't mean that we need to start going into panic mode. And that's fantastic. Imagine we've moved.
It's a good attitude to have, isn't it?
Exactly. We've moved through those phases of, having that panic, chronophobia. And now people are just really more relaxed. They know exactly what to do, how to prevent catching it, by the WHO guidance of wearing masks, hand sanitizing, social distancing, and testing if you obviously have symptoms, and also taking the vaccines and washing your hands. So people are more educated, they have more awareness, more knowledge, and as Nelson Mandela always said, knowledge is power. I'm a firm believer of that.
Absolutely.
And I think that has helped us, and that has made us stronger and more courageous to be able to actually deal with whatever strain, whatever mutation is going to come our way. So bring it on. It's 2022.
Absolutely.
And let's not fear it. Let's face it.
To reiterate your point, I was speaking to a friend a couple of days ago on the phone, and this friend had COVID earlier in the days, like early 2020, and he was in hospital and on a ventilator and all that. And so I was telling him about, we're just having it, normal chat, because he listens to us, watches us on Facebook.
Oh,
and I was talking to him and I said, oh, this Omicron situation. And guess what he told me? He just said to me, oh man, forget about this Omicron thing. It's just like the common flu. When and if it attacks any one of us, all we have to do is just self-isolate, we'll be fine. That kind of perfunctory, attitude towards it. It's like, it's not you. We'll just self-isolate. We'll be okay. And I did say to him, I must confess, I did say to him, I like your attitude towards it, because this is what Dr. Seshni always tells us: face it, don't fear it. Be careful,
yes,
but don't fear it.
Yeah.
And
that's amazing.
I think,
That's amazing to hear. I mean, obviously, he went through quite a serious, period where he was obviously hospitalized in an ICU and on a ventilator. And if someone like that has successfully recovered from COVID-19, from like the more severe type of COVID-19 infection, and his attitude is not to fear it and just get on with it. I think that's amazing. That's what we need. We need to hear more from stories and people like that. Yeah. Sorry, Opoku, I think I've lost you there.
On the Zoom.
Hi, I'm here. I'm back.
Yeah, there she is.
Yeah, I'm back.
Yeah, I like that. Before we go on to the numbers and all that, information on the rules concerning traveling.
Yeah, so traveling, there hasn't been much changes, I would say, in traveling. It's more about the self-isolation period, and that PCR tests are no longer required. So I'm just going to bring up the latest guidance. So during the COVID-19, what the government website is saying that each person needs to check with each country wherever you are flying to, and arrange COVID tests if you need to. And yeah, so and about the COVID-19 pass. So the NHS COVID pass will be, obviously some countries do require it. So before people travel, they need to ensure that they have their COVID-19 NHS pass. And when they return back to the UK, there's more rules about testing and about traveling. So I think that's the latest guidance. So I'm not sure if there's anything else specific. I heard something about India. I heard something about India going into lockdown or until, I don't know if you've heard about India.
Sorry, can you repeat it because we didn't hear it from the beginning?
Oh, okay. So COVID traveling, I'm just going to pull up some details about India because I just wanted to talk about India because I think there's advice about India that about going into India where there's some travel advice that has come out.
Okay.
Yeah. So they're saying that there's restrictions to India. So India is currently seeing a rise in the number of COVID cases. And I think they've actually stopped travel to India, but I'm not sure until what date.
It's from where? From everywhere?
Yes, I think from UK to India.
Oh, from the United Kingdom. Okay.
Yeah.
All right.
And I think in terms of other travel,
so what do we have in the travel industry front?
Yeah. So just going back in terms of the traveling, what they've said is that for each country, you need to check the guidance on the government website, which countries you're traveling to, check whether you need a vaccination passport or COVID pass, the NHS pass, check whether you need any testing or PCR tests. So each country you're going to, you need to check. So in terms of the numbers, we'll do the Worldometer numbers. Is that okay, Opoku? I think you're frozen. So the Worldometer figures as of today, which is the 24th of January, the current Worldometer figures we have is 352,323,862 positive cases. Total number of deaths are 5,615,210 positive cases. Total recovered is 279,973,070 positive cases that have recovered. In the top 5 countries, we have USA, which is number 1 with 71,925,931 with Hi.
Okay, there you go. I was actually doing the numbers.
Okay, I was doing the numbers as well. I was just continuing talking to myself.
In your absence.
No, that's fine. Have you done it?
Oh, are you there?
I'm here.
Anyway, let me continue until when.
So we're just having a bit of technical issues, so I'll continue with the numbers here, and Opoku will continue the numbers on air. So USA, 889,197 deaths. And they're number 1 in the world. Number 2 is India with 543,328 positive cases, and total number of deaths 489,896. Brazil number 3 with 24,044,437 positive cases with 623,145 deaths. And France number 4 with 16,692,000 432 positive cases with 128,629 deaths, and UK number 5 in the world. On the worldometer with 15,859,288 positive cases with 153,862 deaths. South Africa, number 19 in the world with 3,581 positive cases, 359 so that's 3,581,359 cases, and a total number of deaths 94,117. And just to complete it, Ghana is quite low on the list, 107 with 155,496 positive cases and 1,367 deaths. And if we look at the UK 24-hour worldometer figure, which is also in the headlines, we've had 74,799 new cases with 75 new deaths. But the headlines today said 78,807 cases with 297 deaths. So we'll just have to check that. So thank you everyone for listening, and stay safe. Let's spread the love and not the virus, and let's face it and not fear it. Namaste. Goodbye.